Hello and welcome to this special segment where we share insights highlighted by the Director General of the World Health Organization, Dr. Tedros Adhanom, during his visit to the kingdom to attend the first GCC Health Insurance Conference and Exhibition earlier this week. During a special interview with Bahrain International, Dr. Adhanom emphasized that at least half of the world's population do not have full coverage of essential health services, and 100 million are still being pushed into extreme poverty because they have to pay for their health care. Thus, the concept of universal health coverage was born to ensure that all individuals and communities receive the health services they need without suffering financial hardship.
When we say universal health coverage, maybe it would be good to start from the problem so one can understand what it means and what we're going to use the universal health coverage for. Around the world, half of the world population is not having, as we speak, is not having access to essential health services. This is really big. And not only that, even the most tragic is 100 million people descend into poverty because they pay for their medical services out of pocket, and what they pay is disproportionately high compared to their income, and they descend into poverty. 100 million people every year. This is too much. So the reason why we're saying universal health coverage is to address these problems. One, people should have access to universal health, to essential health services, wherever they are and whoever they are. And in addition to that, we can go further and see one of the issues is address the financial barrier. Because if people are not able to pay, or they don't have the means to pay, or they don't have enough income to pay, then that has to be covered. And for this, there are many models. Some countries use general tax to cover all their citizens. Others use insurance system, but the center here is to have access to essential health services, which doesn't affect the family in terms of, as I earlier said, the catastrophic payments.
The World Health Organization, or the WHO, is a specialized agency of the United Nations that is concerned with international public health. It was established on the 7th of April of 1948 and is headquartered in Geneva. The WHO's constitution states that its objective is the attainment by all people of the highest possible level of health. Dr. Adhanom stressed on the WHO's role in garnering countries' political commitment to arriving at solutions towards achieving universal health coverage.
For WHO then, first of all, in collaboration with other partners, we documented the magnitude of the problem, which is half of the world's population doesn't have access to essential health services. And second, we have even identified what percent of that is even more severely affected. Then based on that, we are now advocating for universal health coverage, for health for all, showing that all countries have a long-standing commitment. When I say long-standing commitment, when WHO was established 70 years ago, one of the principles it underlined in its constitution was health for all. And WHO is a member states organization, and it was a commitment, the constitution was a commitment of all member states. And they have already committed 70 years ago to health for all, and health as a right, as a human rights issue, which is an end in itself. So WHO is reminding member states that this is what you have promised, so you have to deliver on that. But not only that, in the 1970s in Almata, there was another commitment, or you can call it recommitted. The whole world has actually recommitted. And then the third is with the SDGs in 2015, September 2015. So WHO is saying we need to deliver on the commitment. We need to honor the commitment. There are countries who are already going in that direction, but this should be done by all countries of the world. And WHO is also saying not only advocating or reminding countries to implement universal health coverage, we're also showing that it's possible. Countries at all levels of economic development can implement universal health coverage. It's not the resources which is the problem, it's the political commitment which is the problem. So that's why also WHO says this is a political choice, and countries should first have the political commitment to make it happen. If they do that, most of the resources they need, even poor countries, can come from the country itself. And whatever comes from outside is actually complementary. So that's why we commend Bahrain as one of the countries who has a strong political commitment. A country that has shown the commitment for many years now, and which is showing that it's doable. And I can give you other examples also based on income levels that with political commitment they have already done it or doing it.
The Director General of the WHO commended the Bahraini experience and the government's commitment towards achieving the set UHC goals. He shed light on the exemplary primary care system in the country. He also highlighted the inclusive coverage to all citizens and residents alike. This, along with the new planned reforms through the National Health Plan 2016-2025 and the National Social Health Insurance Program, Sahati.
The Bahraini experience, one element is it started actually a long time ago. It didn't wait until its economy has been strengthened like now. That's one, the UHC. And this shows that the political commitment to universal health coverage started actually some time ago now. And within that universal health coverage, the other important element is primary health care. And Bahrain actually started primary health care before the Al-Mata Declaration. It's one of the countries that has started before then. And primary health care is the foundation of universal health coverage. And a commitment to universal health coverage, but then identifying primary health care as the central part of the health system is very important. So these are the characteristics. And then the other is it not only covers its citizens, but it covers its guests also, which is very important. And I think you have to preserve that. You have many guests who come from many countries, and covering those guests or people who are coming to you for work is also important. So this is also the other reason which really the other identifier, as you rightly said. The last one is the system is evolving regularly, which is very important. Now we are in a new reform, and that's why we are all here. So improving the system on regular basis is another good identifier of the health system, and we commend the government, its leadership for really not only commitment to universal health coverage, but also for continuing to refine it and improve it and take it even to a higher level.
Dr. Adhanom stressed on the importance of taking responsibility for your health, leading a healthy lifestyle, exercising and quitting smoking. All these initiatives, he said, are important factors to facilitate the attainment of the health development goals.
To the viewers tonight, I have been to Bahrain before. This is not my first time. And the first time I came, I visited even a primary health care, a hospital, and I was really impressed. There is a good system, and there is a good commitment, and that's why there is a good system. But at the same time, we shouldn't consider that this is the responsibility of the government only. And I will cite two examples. For instance, there are two dangerous combinations or challenges in Bahrain. One is smoking. It's very high still. And the second is obesity. And these are two major risk factors that could have significant impact on the health of the individual and the society. But in addition to that, the costs of the health sector itself. But these two challenges can be addressed by choosing at individual level or family level a healthy lifestyle. In order not to be obese, we have to be very active. So we need to stay active or keep moving and stay healthy. And smoking, I think we have to reflect as an individual very seriously and understand the benefits and the disadvantages of smoking, which I don't think has any advantage for that matter, and try to choose a healthy lifestyle. So physical activity and smoke-free would even bring significant change. And this is mainly up to the individual. Of course, I'm not saying the government doesn't have a role. The primary health care can focus on educating or increasing awareness. Our education sector can do that. The media can have a media campaign to increase the awareness. But I think Bahrain should be really serious now and fight, starting from individual level, obesity and smoking, which are dangerous combinations.
Thank you very much, Your Excellency.
Thank you. Shukran.
That's it for this special segment. Our guest was Dr. Tedros Adhanom, the Director General of the World Health Organization. Thank you for watching. I'm Mohamed. Goodbye and God bless.